Thousands of college students across the country are preparing to return to campus, but will your child be safe in a crowded dorm room? Chris Conti takes a closer look at new research that's helping colleges come up with detailed COVID testing plans so they can return safely back to school.
It is hard not to notice the emptiness consuming colleges and universities right now, long ago forced to send students home because of the virus.
They do need that personal contact. They want to know who their professor is.
But Tufts University President Anthony Monaco is preparing for students to return, and he's doing everything possible to make sure COVID doesn't come with them.
So we wanted to test for COVID at a frequency which would pick up most people when they're asymptomatic.
Every student who returns to campus will have to take a COVID test. With 5,000 students expected, Tufts is also expecting a number of those tests to come back positive, which is where these modular dorm rooms come in. Any student who tests positive for COVID will be quarantined here for 2 weeks. The idea is to keep the virus from spreading.
Universities face an existential question here, right? Many of them either open their doors or they face financial collapse that could in fact close their doors permanently.
That is David Pelletier. He's a researcher at Yale, and he's been using epidemic modeling to guide higher education institutions on reopening. Here's what he found. If you take 5,000 healthy students, then throw in 10 other students who have COVID and only test when kids have symptoms, hundreds, if not thousands of students will be sick by Thanksgiving. But take those same 5,000 kids, throw in 10 students who have COVID. This time, though, test every student twice a week and isolate those who are sick. Only about 100 students will end up catching COVID by the fall.
You need to be testing frequently in order to get ahead of the silent spreading, the asymptomatic spread of infection.
You could also just keep universities closed for the fall, but consider this. About 40% of students say they would still return to some kind of off-campus apartment near school, even if classes were virtual. Many public health officials would rather have them on campus where they can be supervised and tested frequently.
And it could be a nightmare. But, the people who say we shouldn't open campuses because this will be a nightmare need to also remember that the nightmare doesn't just go away.
So far, Tufts and about 100 other colleges are using David's data and will be testing students bi-weekly, all in hopes of getting students safely back to school.
They want to be here, and they know that if they are going to be here, these measures are to keep everyone safe, not just themselves.
In Medford, Massachusetts, I'm Chris Conti reporting.